So first and foremost, continuing with the theme of gratitude, I'd like to thank ET Health for really organizing such an awesome conversation here. It's my privilege to be part of a conversation where we have stalwarts from healthcare, pharma, and the entire physician fraternity. So I've been tasked to speak about the digital health adoption across the continuum of care. Now, this is an interesting topic, and before I get deep into what does this really translate from a digital health standpoint, one very critical question: what is the most important goal of digital health? Is it about giving more patients access? Is it about increasing efficiency? Or is it about better quality? Or for that matter, is it about less doctor burnout? And you know, what I spoke about here is all important, but what's really the core of digital health, which is about enabling the equitable care and better patient outcomes. Throughout the session we have so far attended, we did hear a lot of speakers talk about equitable health opportunities for the larger population. And I think it's an incredibly important mission. Pandemic came, a lot of digital acceleration happened, a lot of digital health tools adoption also happened. But is it always easy to truly go forward and make an impact through adoption of technology? Pandemic did accelerate, but at the same time, we do understand technology adoption is always not easy. It's about changing a status quo. It is about making huge investments. And at the same time, you know, taking it to that every single level of care. We're talking about urban healthcare, we're talking about rural healthcare. Is it that easy to truly adopt the digital health at all continuums here? We will talk about how there are certain opportunities, certain solutions which can make this a lot more easier. But before that, I think there are some statistics which I'd like to highlight here. We're talking about a country where we have 7.35 doctors to a ratio of 10,000 patients. Whereas WHO states we do need 10 doctors per 10,000 of the population. Now, this is a gap, and we do appreciate what the government is doing, what the private sector is doing in terms of pumping in more and more healthcare professionals into the ecosystem. But the fact of the matter is the gaps still exist and persist here. So how do we go about providing that equitable care which allows us to truly provide the right diagnostic capabilities, treat our patients quickly with better quality outcomes? That is the question that we have to address with digital health. And how do you really overcome these challenges? And while the healthcare sector, the government's mission across Ayushman Digital Bharat mission, these are some initiatives which are helping us bridge that gap. But there's another very important aspect that is on in this particular sector. We've traditionally seen that eminence, or whenever you're trying to diagnose a patient, if it is a rare situation, rare condition, and to top it off with the conditions that are prevailing in these crazy times that we all operate in, where does a healthcare professional go for his perspectives on treating or diagnosing the patient rightly? He or she would actually go to his set of expert doctors or the part of group that he or she is already belonging to and take advice from that. When we talk about digital health, we're talking about a move from that eminence-based healthcare to evidence-based healthcare. I recently was reading through a book by Professor Rajendra Gupta. He's written a book on digital health, and I think it's a book very well ahead of its times. He's very categorically called about a precedence of evidence-based over eminence. And this actually sums up the goal of digital health all over again. In fact, there's very strong data across the globe to support the fact that clinical decision support systems truly help us in adopting the digital health in its entirety. I will be talking about the data in a bit, but I just wanted to share one quote here from Gautam Khanna, who is the CEO of one of the prominent hospitals in the country, where he spoke about how CDSS contributes to both better patient care and at the same time reducing the physician burnout. To picture this, I think we need to understand how are we truly impacting the patient journey, which is the continuum of care, with clinical decision support system. Think about the stages or, think about the steps that it typically takes a patient to go through that healthcare journey. It starts off from the point where a diagnosis is made, to actually determining a treatment plan, to providing medication advice, to actually giving that entire treatment, to patient education and subsequently patient engagement. Now, every step in this journey is actually a decision point as well as a risk point. Decision because if you take, you need to do the diagnosis right and ensure that the patient is getting the right care. A risk point because any wrong action or any wrong diagnosis or any wrong step taken in this journey can be so critically awful for the patient, in some cases even fatal, and at least it would actually send both the doctor and the patient on a spin to understand what's really wrong with me, which can be so expensive, so time consuming, and further burden the entire healthcare ecosystem that we're trying to improve upon. And given the importance, I thought it's important for me to first of all talk about, I spoke about clinical decision support system, but what does it really mean? And this is about evidence-based content that allows doctors to leverage scenarios or leverage guidance when they need it the most. The time when they're treating patients, how do they take advice or a guidance from a tool, a digital tool, which is backed up by research, backed up by evidence to truly drive a better patient outcome there. A CDS is not just about at the patient care, but it is also about how do we improvise on the quality of physicians that are coming out of the college. It's a very good education tool as well. And in a country like ours, where we are struggling to have a better patient to a doctor ratio. Now imagine if a doctor who comes and understands in a scenario where there are conditions, changing health conditions, and what decision diagnosis should I take? It truly helps the ecosystem in its entirety. I mentioned that CDS helps answer doctors' question. And this is critical because research has actually shown us, I think it's moving a tad too fast. Because research has shown us that in a day, the doctor typically would have 15 to 20 questions unanswered. He does not have an answer for those because, like I mentioned, the conditions are changing, the diseases are changing, and the doctor does not have a response to those questions. But research tells us if they actually leverage a CDSS, 60% of those unanswered questions can actually be addressed by the doctor at the time of giving advice to the patient. Now imagine the kind of efficiencies we are talking about. 60% means almost 5 to 8 questions, and those decisions could actually be life-changing for the patient and for the hospital as well. This is what I'm talking about. It's CDSS creating not just better outcome, but faster, which is the core goal of digital health. And I think doctors around the world do agree to this point that I'm trying to bring about here. I'm sharing data from UpToDate, which is Wolters Kluwer CDSS. Incidentally, UpToDate is going to be celebrating its 30th birthday next year. From the time when I started the conversation till now, UpToDate would have been referenced almost 8,000 times. What that means is doctors across the world are leveraging the power of an evidence-based tool to treat their patients in the right construct. And it's an easily accessible, easily technology-driven solution which can truly make an impact at the time when the doctors need it the most. Another peer-reviewed study at Tokyo Johto Hospital in Japan highlighted that doctors who were using up-to-date CDSS actually had 2% diagnostic errors, versus the doctors who did not use had 24% diagnostic errors. Now imagine we have 100 patients and we're able to add right diagnostic for another 22. The burnout, the challenge of treating more patients with right outcomes is actually taken care of. And this is the power of the tool that I'm talking about here. So the case for CDSS is clear, and I think it's very well supported by data, but there are a lot of myths also which surround the adoptability of CDSS. And I do want to get rid of those myths. You do not need an EMR to be leveraging a CDSS. It is not a very expensive technology. As a matter of fact, it is just a simple application that's available on your phone, on your desktop, whatever you're actually comfortable using while you consult your patients, and just whip it out of the pocket and use it. Most importantly, it's just not for doctors, but it is for the entire ecosystem as well. We do know that there are a lot of nurses nurses are actually by the patient side for majority of ours. And if there are certain complications or scenarios that they need to address, they could just leverage this tool and provide a lot more efficient and right care to the patient at that particular moment in time. I think we also experienced some interesting use cases for CDSS, especially during the COVID time. What Wolters Kluwer did, we provided CDSS free of cost to a majority of clinicians across the world, and 150,000 doctors took up this opportunity. Now imagine in COVID when nobody knew what's truly happening, what's causing this, what are the different scenarios that are building up. Up-to-date actually came to everybody's help to let doctors also understand how worldwide COVID is being treated and what are the scenarios that they need to take care, especially in the comorbidities scenarios. So this is the power of the tool, which allows you to be very, very relevant in treating the patient. And as a matter of fact, we heard it from one of the doctors in Nepal who was immediately able to put this evidence-based, backed up insights to treating the patients and provide better care when there was a lot of misinformation floating across on COVID. So, and importantly, we hear that there are a lot of solutions who call themselves CDSS. It is not a promotion of up-to-date, which is, by the way, world-class. But at the same time, we want our population here to be careful of how they go about choosing the clinical decision support system. The most important aspect is the breadth and the depth of the content and the evidence that can help you when you need it the most. We're just not talking about a technology intervention in collecting the data and collating it for doctors' use, but it is about how do you provide that right information for that right situation. You would have seen a lot of tools which have journals, books, all coming together for a doctor's advantage or a physician's advantage. We're talking about a monograph here. So you put in a situation, you put in a disease symptom, and that's when the up-to-date gives you exactly the information that you need to treat the patient immediately rather than having to sift through a vast majority of information. So when you are looking for a CDSS, it's utmost important that you do have these parameters in mind. It's just not a technology enablement, but it is the depth and the breadth of content backed by evidence and research. We are asked this question many times. We're asking us to invest in a CDSS, but what's the ROI? Needless to say, if your diagnosis is right, if your path of treatment is correct, you're actually improvising on your hospital stays, reducing the hospital stay for the patient. You are recommending fewer procedures. There are fewer medication errors, and in turn, you're reducing the physician burnout. And to that effect, giving back the hospital the ROI that they need on any investment on technology. There's another study which talks about how CDSS has changed the way patient care decisions are being done in Singapore. They say 37% of the time their decisions are much better off as compared to when they're not using a CDSS. And then I think most importantly is what's the core of digital health, or for that matter, the healthcare system. It's about saving lives. And there's a Harvard study which has identified that by leverage of UpToDate over the last 3 years, we've been able to save 11,500 lives. What more noble and what more effective than actually saving lives in an ecosystem of healthcare? So more than the ROI, I think this is what makes a lot more sense for us, and we take pride in stating it is about saving lives. And behind the studies that I spoke about, behind the stats that I gave you, there's one important study that comes to my mind all the time. Not study, actually a scenario. So there was this 1-month-old baby in Japan, and the parents rushed him to a hospital in Japan, and they were not sure what's happening with the baby. The baby was vomiting all throughout the previous night, and when the doctor saw him, he was very sure that if you don't treat the baby now, it may actually prove to be very fatal. As wisdom would say, the doctor did consult his peer group to understand what could be going on with this child. And while he was consulting his peer group, of course, he ran a battery of tests. The outcome of those tests indicated towards type 1 diabetes mellitus. Now, that's unheard of a disease in a 1-month-old baby. So much so, the statistics say that it's only 1 in 500,000 babies who get that kind of a situation. So if eminence would have prevailed, they would have actually not gone ahead with the treatment of the baby for type 1 diabetes mellitus. But the doctor now, who's a very senior, he was a senior resident at that point in time, and now he's the head of department at the pediatrician at the hospital. He actually consulted UpToDate, and UpToDate guided him on that this is type 1 diabetes mellitus. The treatment was taken on, and needless to say, this has a happy ending. The baby did get cured, and every year the doctor gets photographs of the baby, how he's growing, etc. So this is one simple example of how powerful an evidence-based medicine is over eminence-based. And this is what we are proposing, and I just wanted to call out, in India, we have seen the healthcare truly change by almost more than 30,000 doctors leveraging CDSS across pharma companies, across hospitals, and take advantage of better outcomes, better patient care at the time when the patient really needs it. So with this, I'm going to wrap up and call upon how do we go about creating a more equitable digital healthcare with CDSS. We're talking about every hospital providing access to every doctor a CDSS, which allows them to be better at the job that they have to do every single day. And we don't stop at the point of just giving it to every doctor. We're talking about making it inclusive in the education, because that's where the true impact of evidence-based medicine truly comes in. So with that, I'll probably close my conversation here. Happy to take any questions that may be out there in the audience. Thank you.